If you have chronic pain, you've lived with chronic pain, and you're wondering, will stem cell injections help me? That's what I'm covering in today's episode. My name is Dr. Chris Garcia. I'm a leading expert in stem cell recovery, and I'm excited to help you along your journey to feeling better and overcoming chronic pain. Now, why does chronic pain exist? There's many reasons why this exists. It can deal with your medical history in the past. Maybe you fell, maybe you were in a car accident, maybe you've had a chronic disc disease, maybe you've had bad knees and you're wondering, I'm stuck, what do I do next? And after working with hundreds of stem cell clients all over the world over the last couple years, I've realized that there are definitely patterns of people who do well with chronic pain. And I'm gonna show you that in this episode, but more importantly, help you understand how to overcome chronic pain with stem cell injections and then also the recovery process afterwards. So, does stem cell injections help chronic pain? What we've noticed at the stem cell recovery experts that people do very well with chronic pain. Now, what I don't know is your exact history. Have you had chronic pain for 7 years? What have you tried in the past? Have you had 1, 2, 3, or 4 stem cell injections? What about surgeries? Have you had 2 back surgeries? Have you had 1 neck surgery? All of those are a big factor. And what I can say is after rehabilitating these individuals, a lot of people who have an extenuating history of chronic pain do well with stem cell injections. Now, if you've had a recent ankle sprain and you do stem cell injections, you'll have an improvement, but those who've had a longer history tend to do well. And if you've had a moderate history of 2 to 3 years, now what I can tell you is those who really maximize their results are an individual who has had a form of chronic pain. And what you have to realize is stem cell injections is one piece of the puzzle. The other piece of the puzzle is the rehabilitation or recovery process afterwards. Think back to when you were considering maybe having surgery. If you had a rotator cuff repair or a disc replacement or a discectomy, and you were looking for different options and considering, do I need an injection? Should I do cortisone? Should I do a PRP injection? Or should I do surgery? All of those are important factors in somebody deciding to move forward with some type of invasive procedure. So maybe you had that and you wondered, okay, great, that's gonna fix my pain. But the question is, now that you've gotten surgery, all that tissue has been traumatized. So now your baseline level of function is here and you've become traumatized with all that tissue. So now you have to come and make your way up. And how did you do that? You did that with structure. Maybe you tried it on your own, but you probably found a rehabilitation partner or an expert in your local area to help you do that with a program, a systematic approach to start with range of motion and get you flexible and get you strong, be able to get out of that hole and get past your baseline so you felt better than before. And if you've been living with chronic pain, you have to understand that is also a process that once you get this procedure done, although that tissue, now those stem cells are injected in there, they're going to start going through an inflammatory process where they're repairing all that tissue, whether that's your cartilage or muscle tissue or disc disease. Now your body's going through trauma. Now you have to still be able to come out of there. Now you still need structure and a systematic approach to get you out of there. And that's one of the biggest things that I've seen. Those who have the best success are those who've included a recovery or rehabilitative process afterwards. So if you're looking for a quick fix, this might be a challenge. If you have true chronic pain, you've tried a lot of different things and the stem cells are going to help you. That is 100% true. However, the magnitude of your results or of your outcomes will be minimized if you don't consider that post-injection recovery. So if you're thinking, well, Chris, is it going to help me? This is something you have to discuss with your stem cell provider and look at all the research, go through all of those factors. And I truly believe if you've done all of your homework and you've had previous conditions in the past, I think that stem cells would look positive in your future. Now, if you're saying, well, how do I maximize this and overcome chronic pain to the best of my abilities? This is where you would have to consult with experts afterwards for a recovery and a rehabilitative process. And what that might look like is As you consider your stem cells, contact the stem cell provider, but also start to look for, well, who's going to help me with the recovery process. Start to consult with local physical therapists or local experts or virtual experts as consultants. This will give you the picture of, great, I understand what's going to happen in my stem cell injection process. Next, once I am going through that inflammatory process, I need somebody to help guide me to that next step. So you have to have two different people guiding you in this process, the people injecting the stem cells and the ones providing the recovery process. Once you have that lined up, you are now maximized in your outcome. Now, the challenge becomes is if you face chronic pain, you know that pain comes out of nowhere. Your body responds, not an ideal scenario. Maybe it becomes traumatized or has too much inflammatory processes going on, and it sets you back into that chronic pain phase. That can happen during your stem cell injections. Now, what you want to do is work with somebody who can partner with you, can understand how to push you, what happened in the past, how to adjust the variables on, should you be walking more? Is it the right time to go to the gym? And if you try and face this by yourself, you'll realize that if you've tried this in the past by yourself, those are the results that you got. So if you decide to do stem cell injections, which in the past it has shown to improve chronic pain, the next step is, what do you need to do to maximize your outcome? Because you might get 50, 70, 90% better with stem cell injections. The question is, how do you get closer to that 100% mark? And that's by having recovery experts to help you maximize that gap in that process and not to feel alone. So you minimize how much chronic inflammation that you have, how much of that chronic pain comes back from your previous history. So if you're looking at eliminating chronic pain for good, you want to have the best chance of reducing chronic pain. You want to consult with recovery experts. And for anybody who is interested, you can contact my team at the Stem Cell Recovery Experts. We work with stem cell patients all over the world, and we help them get past that chronic pain to be able to live that life they've always wanted. So if you're interested in helping to find somebody either near you or with my team, feel free to reach out to us at any of the information below. And we're excited to help you on that recovery process to conquer chronic pain for good. Hi, if you found this video helpful, please give it a thumbs up. Don't forget to subscribe and hit the bell notification for my weekly tips on recovering safely to create long-lasting results after stem cell therapy. Thanks, and I'll see you soon.